partner with team science grants under Stand Up to Cancer and some other opportunities, partnering with and collaborating with cancer centers across the country.
So you had said you guys were just given an honor, a designation. Let's talk a little bit about that. That's important.
Yeah, so all of these efforts, and as well as the efforts of Dr. Wynn's predecessors and the rest of our team, have led us to apply for and receive comprehensive cancer center designation from the National Cancer Institute. So this is the top level of cancer centers. We're in the top 3% across the country now, along with cancer centers like Johns Hopkins, MD Anderson, Memorial Sloan Kettering, some of the others that people hear about. And this is really a tribute to all the work that our researchers have done, to these team science grants that we've been able to collaborate on with other cancer centers, to the work that we're doing on health equity and closing the gap on health disparities, and just recognized as a leader on this. So having this facility right here in Richmond is terrific, and one of only 2 comprehensive cancer centers in Virginia and one of 54 nationwide.
That's an honor. And a lot of times people don't realize. So when I talked to you before, I talked to Dr. Wynn, we don't look at cancer the same way that we did years ago when I was young. I'm 63. So you didn't even say cancer back in those days. But now people are living with, fighting with it, and also, but a lot of times it does take the research. And that's what you guys are doing. How do you recruit the researcher? Because a lot of that goes off and we don't hear about it. And then all of a sudden, how do you guys recruit the best and the brightest to come? I guess with the designation that says we are good.
Well, that is certainly a big help. And I think, but I think also just Dr. Wynn and the connections that he has around the country, he's been able to recruit folks that he's worked with in other locations. And then as people have been hearing about the great work going on here, they're very excited about it. You can hear from some of these newer recruits about how excited they are to be a part of Dr. Wynn's team and really be on the cutting edge of the research that's being done. And so I think, that is something that attracts them. They want to be at a place where they're also training the next generation of cancer doctors and researchers, so that work that they're doing is continuing. But we're also seeing the results of that research. So we're seeing more cancer survivors, as you mentioned. There are right now over 18 million cancer survivors in this country. So that's pretty phenomenal. And one of the other things that Dr. Wynn's been able to focus on is to get a more active survivor program going. So he has recruited Dr. Susan Hong, who has come in, and she's over the survivor program that we have. And she's just doing some great work to provide more holistic care for cancer patients as they're living with cancer. There are, a lot of other things that come along with that than just really trying to have a broader, comprehensive care for those patients.
So you are a nonprofit, correct?
Yeah, so we operate through the MCV Foundation for all of the development dollars that come in, all of the philanthropy dollars that come in as a nonprofit. Yes.
One of the things is, and we've had this conversation before, and everyone thinks that Massey Cancer has tons of money and resources. They're not like us, the little person over here. And I see the smile on your face. Let's talk about the things that you guys need, because I always say, changing the world ain't cheap, easy, or free. So money got to change hands somewhere. Right. So, ma'am, here's your time to tell folks about what you guys are doing.
Well, thank you. I mean, we have been very fortunate to receive federal and state dollars, so we're very grateful for that. But we also do rely on philanthropy for about 1/3 of our budget. And so this is really the generosity of our individual donors, corporate donors, and foundations that believe in the work that we're doing and want to continue to see the advancements that are being made at Massey to improve the quality of life for our cancer patients and our communities as a whole. So just to give you an example, as we're trying to increase our outreach, we received some corporate and foundation funding for 2 mobile health vans that have just arrived. And we had a few delays with the pandemic, but we have 2 mobile health vans that are equipped, and we're going to be going out throughout our catchment area into the rural areas, really helping people connect with Massey on just being educated about when they need to get their screenings, where can they get those screenings, where can they get treatment, and then what are some of the things that they can do to prevent cancer. So it involves a lot of different facets, things around tobacco cessation, healthy eating, but like I said, getting those screenings, because in some of these hotspots that we've seen where the cancer incidence rates are higher, and in some cases the death rates are higher from cancer, it's often because of a late stage diagnosis. So we really want people to know when to get those screenings, to get them, and then to have access to care. And so just thinking too that, Massey is a safety net hospital. So we provide care to everyone, regardless of their insurance status. And so that is a cost. And that, we're trying to make sure that we can provide the best care to our patients, to everybody who comes through the door, but we're also reaching out to more people in the communities where the need is great, to make sure they have access to that care too. So it takes a lot. It takes a lot for the research to be done. It takes a lot to recruit these world-class researchers to do this cutting edge and innovative research. And so it really does depend on the generosity of our communities to help support them.
Sometimes